Well, you're most welcome to today's talk, Wednesday, the 12th of October. Now, I've had lots and lots of questions about monkeypox. Everything seems to have gone a bit quiet on monkeypox, so what is going on? Well, the bottom line, if you haven't got time for this video, is that it's good news. Cases are declining throughout the world. They're also declining in the United States, where they've been quite high. Also declining in Spain, which was kind of the European epicenter of this current outbreak. Also declining in the United Kingdom. But curiously, and we'll be looking at this later if you want to stick around, black men and Hispanic men and actually Pacific Islander men in the United States are much more affected than white men, whereas in the UK it's predominantly white men that's affected. So something interesting going on there that we'll be looking at later. But let's get down to some of the main points first of all. Now, you remember we did spend quite a bit of time looking at monkeypox. Now, this is from New Microbes and New Infections, the journal. It's believed that African squirrels and other rodents might be the primary reservoir of monkeypox. So really this should be called African rodent pox or African squirrel pox rather than monkeypox. A bit of a bad press for monkeys. I think it's just based on an impression that someone got in the early stages, but this is primarily rodents. Now, the reason to put this in is not just curiosity. There's the possibility here of reverse zoonosis, so it's possible, it's unlikely, but it's possible that, well, we don't know how likely it is, but it's possible that monkeypox could become established in European rodents, in which case it could become endemic and there could be spillover infections into humans from time to time. But at the moment, it's not looking like that. We don't have the data for that, and it's looking encouraging at the moment. Cases seem to be going down really quite nicely, as we're going to see now. So let me just show you some of the graphics here that show this quite nicely. So these are the Our World in Data ones. Now the red there is the world, so we can see cases are going down quite well. These are numbers of cases, so we can see that the United States is going to be fairly high because of the large population, obviously. But when we go into this one, monkeypox daily confirmed cases per million, again we see a nice reduction. But we do see that the United States is relatively high compared to other countries, even when it's adjusted for cases per million. These high amounts here were Spain, but we're glad to see that Spain is going down now, although it was the early epicenter. Cumulative confirmed cases, so as I would expect, the curves are starting to flatten off, which is good news, meaning that the number of new cases is much less. This is daily confirmed cases, just to give us an idea. So we see that we're down at 2-3 cases a day in Europe, New Zealand, Australia, but still about 130, 140 new cases per day there in the United States. So pretty good news altogether, but more cases than we would have expected in the States, but it is declining. And we'll be looking at the reasons for this. Now, because we want to be fully evidence-based, of course, UK Health Security Agency. Current epidemiological situation, this is as of the 10th of October, so fairly up to date, 2 days ago. 3,523 confirmed cases. Mostly, see Scotland 94, Northern Ireland 34, Wales 46, England 3,499. So the majority of these cases have been in England. Largely in London to begin with, but I think now it's worked out that roughly about 70% of the cases were in London due to the concentration of the initial virus and the behaviour that caused it to spread. Cases were confirmed in England from the 6th of May is when it started. The outbreak has mostly been in, this is a direct quote from the UK Health Security Agency, so I don't want to get into any trouble. The outbreak has mainly been in gay, bisexual and men who have sex with men. Direct quote from the UK Health Security Agency. Without documented history of travel to endemic countries. Now, in the past, there has been the odd flare-up of monkeypox, just a few cases, but it's tended to be in returning travellers from areas in Africa where it's endemic. But this obviously means there's been community spread within Western countries. So that's pretty unambiguously the case, as we see. Now, it's still classified as a level 2 transmission here. Now, level 2 transmission... where are we? Is defined. Basically, it's in a subset of the population, but they defined subpopulation. And this, of course, is gay and bisexual men. 99% of cases are in men in the UK, 45 cases only in women, 1% or less, or slightly over 1%. Now, here we have some of the graphics for the UK here. I hope we can see. Where are we? There we go. Technology issues. Right, so this is age and gender distribution of confirmed and highly probable cases in the UK. And we do see that the vast majority, as we see here, are in men. And this is the 24 to 34-year-old age group. So the sort of younger men primarily being affected in the United Kingdom, with a very small amount of women being infected. Now, this is the Nowcast from the UK. Incidence remains low. And here we have the graphic here, confirmed and highly probable cases. And we see a really quite gratifying drop-off in cases. So this is good news from the 6th of May up until now. Now, what's going to happen in the future, of course, we don't know. I suspect it's not going to go down fully. I suspect it's going to sort of be a lowish number of cases for some time. But hopefully it will go down to nothing. We don't know that yet, but there could be a lowish number of cases for some time. It's probably the most likely situation there. Multiple factors in reduction. This is interesting. Vaccination. Now, the UK Health Security Agency say they're moderately confident vaccinations played a role. They think behaviour modification might have played a role, but they have less confidence in that. The reason they think that primarily is that other sexually transmitted diseases are reduced, or some other sexually transmitted diseases have been reduced. There is less of them, which is always good, of course. Routes of transmission, close or sexual contact. Monkeypox virus has been detected in air and environmental samples in hospitals. So it does get into the air. We know that smallpox, of course, can be transmitted in this way, but monkeypox theoretically can, but there's been no cases of it. So it has been detected in room air and on artefacts, but no confirmed cases of airborne transmission. This is all close and sexual contact. Now, there has been limited household transmission. This is not surprising. Of course, there can be fairly close but non-sexual contact within households, which could have facilitated this spread. So that's a possibility in terms of household spread. So the assessment is transmission primarily through close or sexual contact. They're moderately confident of this. Well, I would have thought it's fairly conclusive, actually, but that's what they're saying. So that's what we'll report. Clinical severity, no deaths in the UK, which is excellent. Morbidity among people admitted to hospital, mostly for severe pain and secondary bacterial infection, which isn't surprising. There has been a case of inflammation of the brain, encephalitis, but it appears to be uncommon. You can get this with viral conditions, an inflammatory reaction that affects the brain, but thankfully this appears to be uncommon. So it looks like we've been pretty fortunate with this. This could have gone the other way. When the very first time we reported this, we said there's not going to be a pandemic of it, and we were fairly confident that that was correct at the time. And it does appear that our predictions have been more or less correct. We weren't overly worried, but of course we have been following it with interest. It's another new infectious zoonotic disease. Right, US situation now, United States. 26,778 cases as of the 11th of October. So on a national scale, we're not talking about huge numbers. And thankfully it went the other way. Of course, it could have increased. It could have gone into heterosexual population. There could have been airborne spread. There could have been all these things. We didn't know at the start, but it's looking now like there's not. So we can be more optimistic, although certainly we don't want to, certain communities should not be letting their guard down at this relatively early stage. So the United States been quite badly affected. Now this is the daily confirmed cases in the United States. So we see it's going down nicely, still going down, but still, as we see, higher than other countries. In the United States, they've given quite a lot of vaccines. Now, frustratingly, the vaccine data for the UK is not there as much. It seems that most of the vaccine data is for the United States. But here we see it here, and here we see that well over 750,000 vaccines, isn't it? 873,000. So the dark blue here are the single doses, and the lighter blue are people that have had additional doses. Having said that, there has been a lot of vaccines given out in the United Kingdom, but we don't actually have the figures here at the moment, unfortunately. Now, UK ethnicity data, this is interesting. So UK ethnicity data is about going with the population. So white, 77.3% of cases, Asian 6.7, black 4.1. So predominantly going with the prevailing ethnicities in the United Kingdom. Roughly what you would expect, but in the United States it's not. US ethnic mix. Now this is from the Kaiser Family Foundation. Don't know much about this. Do let me know if it's a good quality data organisation. It certainly appears it. Monkeypox case rates amongst black people are over 5 times those of white people. 14.4 per thousand versus 2.6 per thousand per 100,000. Sorry, 14.4 versus 2.6 per 100,000. So we see a very significant overrepresentation of black men in the United States compared to the United Kingdom. Interesting. I'm kind of thinking about that as we say. I haven't got any firm conclusion yet on this. Do let me know what your thoughts are on this matter. So way more common in black men than white men in the United States. Also higher in Hispanics in the United States compared to the share of the population. Now here we have the makeup here. So we see, and these are rates per 100,000. So white men fairly low, and it is primarily men, of course. Again, Hispanics much higher, black even higher, Asian. Now these last two here, I've had to write them down. This one here, AIAN, is American Indian or Alaskan Natives, and this one here on the end is Native Hawaiian or other Pacific Islanders, who also have a very high rate. So Hawaiians and Pacific Islanders, blacks and Hispanics with much higher rates than whites, Asians and American Indians. And I don't know why that is. Whether it's socio-economic, whether it's some biological factor, insufficient data to comment on that. Of course, we do know that black people in the United States have lower levels of vitamin D than white people. Whether that's a factor or not, we simply don't know in this case. So there we go. Overall, pretty optimistic that monkeypox is going to go down. It is still going down. Don't think it'll go away together. It could be with us at a fairly low rate for another period of time. If I said a period of time, I would purely be guessing. We'll report on it again if it's looking interesting. But if things carry on dwindling down, hopefully this will be the last video we do on this. But it's been interesting to follow it, and we're just all very pleased that the rate is going down. But caution, I would still strongly advise. Thank you for watching.